Liz, thank you so much for being here. We're so excited to have you here on Chick Chat.
Thank you for having me. I'm excited to be here.
Yes. Oh gosh, Liz, pelvic floor therapy, all of the therapy. I think I need it. Maybe some of our listeners do too. But we'd love to learn more about you and your specialty and how you got started. So, Liz, please tell us about yourself and your background and what led you to where you are today.
Absolutely. Well, I will say you may need it, your listeners may need it. We all need it, right? Okay, so this is for everybody. So I'm a pelvic floor PT. I'm board certified in women's health. And kind of my path here was my best friend in college went to medical school and became an obstetrician. And we had been really close all through school. And we were both in, I was in PT school, sometimes she was in medical school. And she called me up one day and she was like, Liz, I have this patient and she's having painless sex. I can't find anything wrong with her. She's like, have you learned anything in PT school about this? And I said, yeah, I got like a 1 hour lecture on everything pelvic, and there are people who do that, and you should go find one because I don't do that. Um, and she was like, okay. And then 3 days later, she called me up and she was in Ohio at the time. And she was like, I can't find anybody. She goes, you need to do this. I was like, well, I'm not going to be able to learn enough in time to help your patient. But I was like, I'm interested. So I initially just got intrigued by kind of the intellectual side of it because it was just like a whole other area to learn about in terms of obstetrics, gynecology, or gynecology. And it was intriguing to me. And then when that piece came in about what she was talking about in terms of there not being enough providers, and just the fact that it was this thing that felt so private and secret and like nobody was really talking about it and I felt like it shouldn't be that way, kind of drew me to it. And I'm so glad that people like you exist who are bringing this into the light for people to be able to have a conversation around it. So fast forward, I began teaching at UCSF's PT program, doing pelvic health. So now we get much more time in this, at least in their program, we do. And then I started teaching nationally for the Academy of Pelvic Health, opened my own clinic, and then joined Origin as their head of clinical quality and education. And they're right now the leading provider in women's healthcare in the United States around pelvic health.
Oh my gosh. Well, we're so grateful that you're doing what you're doing because you're so right. I feel like my background, I've worked with a lot of pregnant women and postpartum mamas, and that is when typically women really start experiencing some major changes to their pelvic floor. And finding a good care provider that they can trust with their pelvic floor can be challenging. But I feel like I'm
Yeah.
so grateful. I'm hearing more and more people talk about this and more people like you that are specializing in this because I think it's something that just hasn't been given enough attention to. I feel really bad for our mothers and our grandmothers who didn't have this kind of support after. And I'm hoping that we're making that change this generation and onward to just have that standard of care to make sure that women's bodies are taken care of, right?
Yeah. I feel like there has been a lot of, well, my mom experienced this. That was probably my first experience with pelvic health issues. Was I had a friend who wanted to go running and she'd had two children and she said, "Well, hold on, I have to go put a pad in." And I thought, well, "What are you talking about? Like, oh, you're on your period, right? Like you've got to go get a pad." And she's like, "No, I leak urine when I pee. Whatever. It's totally it happens to everybody. Like it happens to all of us." And I remember at that moment in my mind thinking like that does not feel normal. That, a 23-year-old is putting a urinary pad to go running. And she was military, so she had to run all the time. She had to be really super active. And there's just this. She's like, yeah, it's just that's what my mom told me is that that's just normal, and we need to stop this idea that these issues, yes, they may be prevalent, but that doesn't mean that that's how our body is and should be working.
Amen. I agree. Common is not the same as normal. And
Right.
and I'm hoping that this is actually becoming less common and so people are like, "Oh, yeah, I need to go see somebody about this and get the help that
Right.
I deserve and need to take care of my body." Oh my goodness. Yes. So, what was it that really made you become passionate about pelvic floor physical therapy?
I really do think it's just that piece about people not getting the access to care that they deserve,
Mhm.
and being gaslighted about their issues and being told, like, oh, okay, whatever, sex is supposed to hurt, go ahead and do that. And the more I just saw that happening over and over again in
Mhm.
ways in which there are actual avenues for to treat it instead of just having to live with it, made me feel like this is exactly where I need to be. I want to be an advocate for women, all people in pelvic health, to make sure that they aren't being told that what they're living with is just a part of daily life. So that just really brought me to a place where I was like, this is what I have to do. And not very many people are doing it. And in fact, I think in physical therapy, you really see a lot of people, at least you used to, who came into physical therapy because they were sports driven, right? That's actually how I came to physical therapy. So I broke my back playing basketball in high school,
Oh my
went to a
gosh.
physical therapist and was like, oh, wow, this is amazing. This is what I'm going to do. I'm going to be a PT. And it wasn't until later, when I had that experience with my best friend, who is a obstetrician, who got me interested in this, that I started to think about it. I didn't even think about it in PT school. I thought, oh, that's really gross. Like people might pee
Vaginas,
on me, and
what?
I don't want to do that. Yeah. Um, until my friend Valerie, the OB, she said, I was working in wound care at the time, and she's like, I have a feeling that the things you're doing are way grosser than pelvic health would be. And I sat and I thought about it, and I was like, you are absolutely right. You're absolutely right. My job is actually pretty dang clean, which is really lovely for me. But yeah, it was just that feeling that people weren't getting, and you hurt your knee, you have 1,000 options to go
Yes.
see somebody. And why is it that there are so many options for the rest of your body? And when it comes to this one area of our bodies, we're like, oh no, we can't talk about that. And then there's nobody there to help you. So
Exactly.
that is really changing. We're seeing a lot more people. I used to maybe get one or two hands up in a classroom of people who are interested in going into pelvic health. And I believe in this year's entering the third year of their program at UCSF, we had 12 people out of the class that were interested in doing this. So we're seeing more and more people entering PT school who actually want to do this on the outset.
I love it because that just means there's going to be more support for people out there who are
Absolutely.
suffering from these problems. So, oh, I love that.
Absolutely.
Oh my gosh. So, Liz, what are the most common pelvic health symptoms women experience?
I'm so glad you asked because we just did a large pelvic health study in conjunction with Ipsos. And in the past, it's been really hard to get people to give honest answers about what's happening
Mm,
with them, or
mm.
the answers were only coming from people who were seeking care. And so this was a large study that was done in the general population. And I'm going to give you several of the top ones because I think I don't want to leave any out. So there's a little bit of
Perfect.
a
Do
list
it.
here.
You love it.
But the number one that we found was straining to poop. So, and people may think, oh, I thought that was normal to strain to poop. You should not be straining when you poop. So that was like the number one thing that of pelvic health symptoms that people are experiencing that we saw. Incomplete bowel movement, so feeling like they haven't actually emptied themselves fully. And you would think, oh, maybe like urinary leaking would be number one. Those were actually the top two.
Wow.
Then it was leaking pee, peeing more than every 2 hours or peeing right away after you feeling like you needed to go like right after you went. And then equal the same number of people had an inability to reach orgasm as those who could barely hold their pee in. So if you think about all the people you know who have a hard time holding their pee in, like, I gotta go, I gotta get to the bathroom, the same number of people out there are suffering with an inability to orgasm. That was 33% of the people in this study were reaching
Wow.
those numbers. So, and those are things that like nobody in a doctor's office is really asking you. So, hey,
Right.
how's your orgasm?
Yeah.
Like
Yeah.
we don't tend to medicalize it, but that's still a pelvic health symptom. And that's why I wanted to list all of those because I thought that that was such an important one to mention.
But that is so fascinating, especially the first 2 about bowel movements. Like, you wouldn't think those would be the top 2. I didn't think that. I would think urinary incontinence and then the rest. Wow.
Well, constipation is actually one of the number one reasons for visits to primary care providers. So it makes sense that straining to poop or feeling like you're having incomplete bowel movement would go hand in hand with constipation. And that's something that pelvic health therapists can treat that I think a lot of people don't realize, and something that a lot of pregnant women, postpartum women suffer with. Like, think about what do you go home with from the hospital, right? You go home with
Yeah.
laxatives.
Yeah.
So
It's so true, it's on my list. You have to have a stool softener because that first postpartum
Hmm.
poo, gotta prepare
Yep,
for. Oh
exactly.
my gosh, that is I didn't know that. I didn't know that that was something that pelvic floor therapists could also treat, so that's really fascinating. Oh, man, so
Absolutely.
basically you guys really help all the situations down there, which is great.
Exactly.
So, what do you think are some of because that was a misconception of mine. What are some common
Sure.
misconceptions when it comes to pelvic health? Or yeah, the
Um,
pelvic health,
s-
sorry.
so Nina, what you were saying in the very beginning when you were talking about how so many of these symptoms come on around the pregnancy, postpartum time,
Mhm.
you hit the nail on the head. So I think the biggest misconception is that people are suffering with this who are old, right? So like you
Yeah,
think of like your grandma, your great grandma is having these problems. These problems are actually starting much earlier in life. So, in our study, we found that millennials were the place where we were actually seeing most of the dysfunction starting. So, that age 28 to 43 age range, that's where the biggest jump in symptoms actually occur.
which is
So, it's not
childbearing
this
age, so that makes sense.
exactly,
Wow.
exactly. So, it kind of goes hand in hand. And then, and we have people with symptoms as young as 18 or even younger, right? So, and I think that that's something too. Like, if you think about children who have toileting issues, this isn't just something for old people. And sometimes those behavioral issues with toileting, et cetera, that happen in childhood follow you through life. So these are things that we shouldn't just be thinking, oh, we don't deal with that until you get really old, right? Like, let's deal with these problems now so
Mhm.
that they're not bad when you age,
But I think also a misconception is, oh, maybe you need to wait and wait
right?
until it's really bad to get that help, like, when you're old? Or, oh, I'm
Right.
or maybe you're listening to this and you're older and you're like, "Oh, it's too late for me to fix this kind of stuff." That's probably another misconception, right?
Absolutely. And it's never it's never too late and it's never too early.
Yeah, just
So
get assessed.
just take care of it. And I do think that there is definitely this perception of like, especially people who are going to have multiple births, right? Like,
Mhm.
oh, I'll just deal with that after I've had my second or my third or however many I'm going to have, and then I'll just kind of like do the whole deal. But if you take care of yourself before you even get started, or if you think, oh, it's too late, I already had two, I might as well just have a third. No, go in, get care, understand how you can make things better for yourself, and you can start right then. So, absolutely, it's never too late.
And I bet you probably have some great tools and tips to help with, oh, if you're planning on having another baby, like what to do during pregnancy, what to do during childbirth, even, and immediate postpartum care, right?
Yes. And I think that sometimes there's this idea, well, I already did it once, so it'll be
Mhm.
fine the next time around. But I think we all know that two births can be very different from one another, right?
Totally. Yes.
So you can have a cesarean, you can have a vaginal birth. What happens in those births may be very different and often are.
Yeah.
So understanding how you can take care of yourself ahead of time so that you're ready when it comes, I think is really important.
Yeah. And that's another thing. I bet people think that, oh, I had a C-section, so my situation down there is fine. A baby didn't come out. But there's a lot of pressure going on even during pregnancy, mamas.
Absolutely.
So you might still want to, like, if you're feeling like something is off, if you're not, like, if you're feeling fine, I think you're fine. But if something
Right.
feels off, it can even happen with a C-section.
Oh, yeah. I can't tell you, I have so many people I see for painful vaginal penetration with intercourse who've had cesareans.
Oh my gosh. Why
And
is that? You think?
they just thought like, oh, I gotta get out of jail free card with my vagina because the baby didn't come through that door. And it's like, no, you're still experiencing a lot of hormonal changes and your pelvic floor muscles are doing things to accommodate this extra weight. So sometimes there that is dropping and being too weak because there's so much weight on top of it. And other times it's like clenching to hold it all in place. So if you've got a lot of clenching going on and you're trying to put something in there, it's going to make it a lot more uncomfortable. And that might even just be correlated to other things like anxiety, where we're stressed out all the time and we're just, instead of maybe our jaw being tense, our pelvic floor is tense, or maybe both, because those two things actually go together. So if you have a tight jaw, you might have a tight pelvic floor.
Oh, man. Talk more about that because I totally think that there is a vocal and pelvic floor correlation between the 2. One, if you look at them, they even look similar, but tell me more about that.
Oh, sure. I mean, since we're talking about birth, like when there was actually just a study that came out talking about vocalization during childbirth, so during
Yeah.
bearing down.
Mhm.
So, and I've been doing this for years with my patients where we do push practice and have the patient or have the person make a sound, right? So, trying it with different levels of vocalization. So, I'll have them make like a ee or a or whatever sound feels good to them in terms of how they want to get that energy moving through their body. And oftentimes it's that really low, like
Yeah, that
guttural
guttural, yes.
type of animal pitch. And you hear it a lot in like yoga classes and and the really hip mamas who know that that's like, oh yeah, like your animal comes out and then you have to like give birth. But I think for a lot of people that aren't into that, they may think like, oh no, that's like not for me, right? I'm going to have like a really clean hospital, beautiful birth. I don't make any noises. Like, no, making noise is good. It actually helps you to kind of drop your pelvic floor down and open it so that the baby can exit. So I work on that with people a lot. So, and you got to have your mouth open in order to be able to make those noises. But yeah, we do see a correlation too, just in tight jaw muscles and tight pelvic floor muscles, just a tendency of the person to kind of clench down as a response to stress or anxiety.
So interesting. Oh my goodness. Okay, so Liz, what should women know about postpartum recovery and pelvic floor health? Because we're talking about birth, but then, okay, they just had the baby. What do they need to know postpartum?
um, a lot
All
because
the things.
their doctors aren't telling them all the things, unfortunately. So that's if you want to talk about gaps in healthcare, we could talk about gaps in healthcare, but it is like we need to be telling them a lot of things. So it's great you're here giving them this information. One thing, what we talked about earlier, right? It's never too early or too late to seek care.
Mhm.
So even if you just had your baby, if you had your baby yesterday, go ahead and make an appointment. That's fine. Okay. There are things we can do that don't involve us touching or doing examinations with our hands inside of you or touching you that we can help you learn how to do things like around good body mechanics, et cetera. Day one, you have to start lifting that baby, changing the baby's diaper, right? You have to know how to do that with a body that's trying to recover. So if you're having discomfort of any kind, right? So not just vaginal or scar incision discomfort, like low back pain, your wrists are hurting, your upper back is hurting, all of those things can be addressed. If you're having urinary leaking, of course, that's the one we all think of, but also if you're just leaking gas. So sometimes when we tear with childbirth, that tear can go down into the anal sphincter and it can disrupt our ability to really understand what's at the door. So is it gas? Is it stool?
Mhm.
So if you've got any kind of leaking issues happening there, heaviness in the pelvis, that's another big one where people just feel like maybe a tampon is stuck in there. Um, or they feel like there's a bulge there when they go to touch, like it's uncomfortable. That would be a reason to seek pelvic floor care. That's not normal. Or if you're just really feeling like you have a loss of abdominal tone, a lot of people talk about DRA out there, like split abs. I don't like the word split abs. Your abs aren't actually split in half; they're
Mhm.
still intact. But that's like common nomenclature. But if those things are happening, don't ignore it, get care. Um, Talk to somebody about it because there's things that you can do. So watch out for those things. And I would say take it easy. So that's one of the biggest things. People, I think we are women and we are like, we are going to do all the things all the time. And if you could just please take it a little bit easier, that would be good.
It's so true. Why are we like this? Because I feel like if we're not like that, then we feel like we're not doing enough as a mother. And then
Right.
that means we must be a bad mother, which
Right.
couldn't be further from the truth. You're a good mom. Oh my gosh. And so when you're talking about all this postpartum recovery, another thing that I hear from women, actually my last doula client, she had to have a C-section, and she's like, "I'm having hemorrhoids. Why? I didn't have to push. Like, what is going on?" So, what do you guys say about with that?
She's just pregnant with hemorrhoids. Well, people have hemorrhoids all the time without even being pregnant.
That's
So
true. But I feel like a lot of people experience hemorrhoids after pregnancy even more even if they never experienced it before. Like I mean, I'm going to be honest, I do. So and I never had that problem ever until after I pushed out my first human being, my son, and I was like, "What the heck is this? This is not cool."
Well, it's a lot of downward pressure, right?
Yeah.
And so hemorrhoids are just vessels that have basically swollen or prolapsed, and the blood is sitting in them, and that blood needs to exit. So if you don't have good pelvic floor strength and flexibility, then those muscles kind of can't do their job in order to keep the blood flow from pooling there.
Mhm.
And if you've been bearing down a lot, then that just makes the situation worse. So, educating people about not straining to poop, one of our top reasons, top pelvic health conditions, right? Not straining to poop, how they can adjust their diet to make it so that it's less likely that that will occur and help to create flexibility and strength in the pelvic floor.
Awesome. So that is another thing that you guys can even help with because again, like you said, there's plenty of people who experience hemorrhoids without even being pregnant. Men experience that as
Mhm.
well. So that's good to know that with a lot of these common issues, especially after having a baby, those are things that you guys can help us with because I think that's another thing that they're like, "Oh, I don't know. Like I can talk to my OB about this, but they don't really help with that. They can't,
No.
you know." Exactly. So they're like, "Well, who do I turn to for this kind of stuff? Like that's so intimate and private." So it would be you guys, right?
Yes. And so that, like, you are just playing so well into everything that I want to say today, Nina, because
Perfect.
we found that 44% of women say that their providers did not help them understand what is and isn't normal. So they don't know where to go. And I wish that after every birth, physicians would say, just go see a pelvic PT for every single visit, right? Because they need that education about what is and isn't normal and about what who can help them, right? So that's the other thing. Pelvic floor PTs, even if we can't help you, we know the right specialist for you to go to, and we can help
Right.
connect you with that, right? And unfortunately, right now, ACOG only recommends PT if you're experiencing urinary or fecal leakage. And we have been talking about so many other things like hemorrhoids, right? That would not be a reason for a doctor to think to go send you to a pelvic PT. So if we just created this like blanket, like, hey, everybody who has a baby goes and sees a pelvic PT like they do in France and other countries where they value it, and also value the birth rates. Like this is another reason why we think perhaps birth rates are declining is because people aren't getting the education that they need around this. They're like, forget it, I'm not doing that again, right?
Mhm.
That seems too scary. I don't know what could happen. And if we just educated people about what to expect, then maybe they would be expecting more.
Yeah, like better care and better
Yes.
recovery and all of the things that we should have. And I love that. That's so great because and we were just talking about you said so many of the different symptoms that people can go and
Mhm.
see a pelvic floor therapist about and like I just didn't realize, oh, even hemorrhoids, something like that. I thought it had to be like urine linkage, pain with sex, that common things that I think of when I think of a pelvic floor therapist. So now we're learning actually it's so much more, like even constipation. So let's talk about them all. Like what are some signs that indicate a woman might benefit from pelvic floor physical therapy after especially after childbirth?
There are so many.
Let's go through as many as possible.
Okay, let's talk about sex. So I think that everybody just thinks, oh, I've had it. Well, the people who've had cesareans don't think that they're going to have pain with sex, but you might, or
Yeah.
you probably still will. So having discomfort with sex, the inability to reach orgasm, delayed orgasm, pain with or after orgasm, just an unsatisfying orgasm. So these are all things I think people just think like, oh, well, that's just it for me, right? And it's like, well, maybe if you had better pelvic floor health, we might be able to change your perception of this a little bit. So those are all kind of
That's good
little
to know because they might
things
be
to think
thinking, "I
about
just need a
with
better
sex.
partner," maybe. But actually, you can maybe do some internal work too to see if there's something wrong.
Yeah, yeah. I mean, and unfortunately, as PTs, we don't give like hot sex tips. Um, but we do have knowledge about positioning and things like that that might be able to change things for people. There are products out there that can also help. I know we're not plugging anything today, but people who are having pain with like deep penetration, there are these little products called O nuts. They're like little donuts, little silicone donuts that you can put on your partner's penis, and then they just can't penetrate as deep. Right. So sometimes it's just problem solving, and your PT knows about all of these tools and things that are out there that may not seem like, oh, I would think about that, right? But we have that functional knowledge of how to change things when it's related to body mechanics, or just what is it you're dealing with, and how can we think of a way to just change that for now while you're working
Mhm.
through the process of physical therapy to get better, right? um, Tailbone pain. So that happens a lot with childbirth, right? Especially if you're birthing on your back and your tailbone is straight into the surface that's underneath you. So people end up with a lot of tailbone pain with sitting, and they don't think about pelvic PTs being able to help with that. Vulvar clitoral itching or burning. That's another one. And I know these are people might be thinking, oh my God, I did not know that people suffer with these things.
Or they're like, "I
Um,
thought that was a yeast infection. Don't I just talk to my OB? I didn't realize I could talk to a pelvic floor therapist about that."
Well, and have you gone to the doctor 400 times and taking fluconazole 400 times, and yet you're still itching? And
Yeah.
you're rarely getting, you might not even be getting cultures at this point anymore. Same thing for recurrent urinary tract infections. So oftentimes people will think that they're having recurrent urinary tract infections, but they're not getting cultured, and they're going on antibiotic after antibiotic. And it's not actually UTI that's causing their problem.
Wow. This is fascinating. Please continue.
We already talked about having the sensation of like a tampon in your vagina. You might feel like there's like something in your rectum, like a sensation that something is just sitting in your rectum and it shouldn't be there. So sometimes that might be that incomplete, that feeling of needing to
Mhm.
go poop, but it might actually not be poop in there. It might be a nerve dysfunction that's sending a signal to your brain that makes you think that there's a foreign object in your rectum when there's not. Um, let's see, pain when you poop. Um, Feeling like it takes you a really long time to start your urine flow. Um, let's see, like what else can I think of? I feel like I've kind of touched on most of them in one way or another
No,
throughout
this
this
is perfect.
call.
This is perfect. No, these are good ones because those aren't typical things that I would think of that a pelvic floor physical therapist could really help me with. So this is really eye-opening because I just tend to think, "Oh, if I'm having leaking issues or pain during sex, those are like the main things." But tailbone, you're right. I've heard of some women breaking their tailbone in childbirth and having all of these issues. So knowing that you guys actually can help, with any discomforts in that nether region, really, or just something that feels this shouldn't be normal. I shouldn't be
Mhm.
experiencing this. Yes, I had a baby, but it doesn't mean that everything has to change. I can maybe improve on this and get better. So maybe I should talk to somebody and see if there is something that I can do. So that is what's
Yeah.
encouraging and really awesome to know that you guys can help with a plethora of different things. So yeah, I also we talked a little bit about this, like this gap in maternity care
Yeah.
when it comes to women caring for their own pregnant and postpartum bodies. So how do you really think we can bridge this gap?
Oh man, education.
Yeah.
So it's, and I just love that we live in this phase now where we can get education through podcasts, even
Mhm.
TikTok, right? I feel like most people are getting their information through TikTok these days, which can be good and bad. Some
Right.
of the
Yeah.
information that's out there is often just for clicks or trying to get to sensationalize things, right? That are maybe not necessarily true. So just making sure that you can always like back it up with a real source, whatever it is that you're reading about. But just the fact that it's out there, I think gets
Mhm.
people talking about it and gets them interested in it. And that kind of starts that cascade of information. So I really wish that again, it was like if to bridge this gap, it was just every person got physical therapy after they had a baby, right? But
Mhm.
that leaves out all of the people who don't have babies. So, or maybe they're trying for a really long time to have a baby, and
Mhm.
so and those are people who are typically very good at educating themselves because they have been working so hard to get pregnant, right? And they are just pouring themselves over understanding, they're pouring themselves into understanding everything they can about having a baby. Those are the same people that would do so well if you educated them about what could happen to their bodies and how to prepare for themselves. They would prepare in every single way for that baby to come, right? And then they would take care of themselves really well afterward because they want to be the best that they can be for their child, right? Like we all want to be the best that we can be for our child. But I think sometimes we have this idea that it's like, oh no, I have to do everything for the child, right? Like they come first. But we've all heard put your own air mask on first, right? Like when you're, and then you can help the child, right? Like if you're not taking care of yourself, then it makes it harder to enjoy and be with your child, right? Like, do you want to be able to get on the trampoline when your kid wants to jump with you? Or do you want to have to like say, sorry, mom, I can't do that?
Yeah. Or go on a run or all of those little things that without putting on a pad.
Yeah, and that's one of the most accessible exercises for people after they have a baby, right? Because they're like, I can put the kid in a running stroller and I can go. And it's much harder for them to access any other type of exercise.
Yeah.
So it's you want to be able to maintain that ability to exercise. That's one of my hot tips, by the way, too. One of the things that people don't usually know is we really recommend that you don't start running until about 3 months postpartum. So again, that's that like take it easy, try not to run in those first 3 months, especially if you have stitches. We don't want to break stitches or bust stitches, right? We want everything to heal so
Mhm.
that you're not going back in to have to get something restitched up. And even if you didn't get stitches, we need the uterus to fully go back to its original state and for the swelling to come out of the tissues and for things to kind of settle a little bit before you start running.
Which is interesting because I know our listeners will say, "Well, what about that 6-week checkup that I have at my OB, and that's when I'm
I
supposed to
know.
get cleared for exercise." So, Liz, you're telling me that actually maybe I can work out, but just no running, or, like, what else should I
Yeah.
not be doing?
So you should be walking, right? So in that
Mm,
period when they say you're good to go, you start your walking program. You should have already been walking like immediately postpartum, right? Like if you had a baby and you can walk in the hospital, walk in the hospital. It helps prevent blood clots, etc. But you should definitely be getting up to tolerance of being able to walk for like at least a half hour a day so that we can then transition you into a running program, right? There's lots of things you need to be doing strengthening wise to get your body to run so that you don't end up injuring yourself at that time when you start at the 3 month mark. But yeah, there's lots of body weight exercise, yoga, Pilates, things that you can do. Even riding a bike if you don't have a really sore perineum, if you're sitting on a bike seat and that's comfortable to you, riding a bike is pretty good. But running where you have a lot of intra-abdominal pressure and pounding happening on the pavement. You probably also wouldn't start like a rebounding trampoline class uh, right at 6 weeks. So I would kind of,
yeah,
I,
probably not.
I would put that in the wait 3 months pile. Yeah, and doctors, they're basically looking at, is there something really serious here, right? Is there an infection? Have the stitches busted open? We need to like deal with deal with something here. Is there a hematoma, like a giant bruise inside of the vaginal wall happening? Is there retained placenta? Is there danger to the mother? Um, oh no, there's no danger. Then go do whatever you want, But they're not thinking about what's really best, right? They're
Right.
not having conversations about how you ease into sex. Hey, if you have a dildo at home, maybe try putting that in first before you're doing it with your partner. Like, just see how that feels when you're the one who's in control. So I think that there are steps you can take so that you're successful with things rather than just like diving in.
Interesting. Okay. And Liz, what are the most important things that you think all postpartum women should know about when taking care of their body after childbirth?
Good body mechanics are essential. So hinging at the hips, not lifting with your back,
Mhm.
drawing your belly button to your spine. Those are the things that are going to protect both your back and your pelvic floor. So it's all the core, right? So if you are paying attention to how you move and you move carefully, you're going to be able to protect your body and protect yourself much more easily.
Mhm.
So learning how to draw the pelvic floor in at the same time that the abs come in so that you have a nice canister that's supporting your pelvic organs and supporting your back is really important because you are moving in a thousand ways every single day, right? And these are things that you can even learn in pregnancy before the postpartum time comes up, because your center of gravity is changing when you're pregnant, and how you move, people are going to be more prone to injury, right? Because things are changing different, your ligaments are all loose. Um, so learn those things early on, but that's something you can really do to take good care of yourself. And pelvic floor PTs can teach you that too, right? And if you are stuck at home because uh, you had preeclampsia that's extended into the postpartum period, and you're like, well, none of this applies to me because I can't leave my house, or I don't have any childcare. I can't do things, like, we have virtual physical therapists that can watch you move in your home with your baby and see how you're doing it and give you tips on how to do it right and what that should feel like to manage that pressure in your pelvic floor when you're doing those activities. So that's a big one. The other one would be the don't run until 3 months. And then make sure that you're getting some sort of a return to running program, that you're not just going out the door and trying to run what you ran before. So instead of like couch to 5K, think birth to 5K, in
Mhm.
terms of like a walk run progression. And again, just take it slow.
Love it. Yeah. And you were just talking about core and pelvic floor, and I totally think that yes, they definitely go hand in hand. And I want to get your thoughts on a belly binder then, or like the
Sure.
corset stuff, because I know that people are like, okay, my core, I need to cinch everything. And, I think that there's definitely some benefits to that compression, but but with you here, I'm like, okay, she knows all the things when it comes to our pelvic floor. I know that that's a lot of pressure on our pelvic floor, if
Yeah.
it's applied too tightly. So what are your thoughts on that, and can it be done appropriately? Is it just yeah, I want your thoughts.
Oh, you're getting all the touchy topics here today
Yes.
because
That's
people
what
feel
we try to
really
do here.
strongly. I love it. Um, and cultures have been doing this for centuries, right? There's like the traditional binding that they do where the women come in and they wrap all the fabric around your abdomen and it looks really beautiful and they bind you, and that's meant to help everything kind of heal back into place. Um, Interestingly, I think a lot of people think about this in terms of diastasis, so that abdominal separation, trying to bring the
Mhm.
abs back in together. We found that in most cases, the abdominals close on their own within the first 8 weeks postpartum without needing any type of splinting or binding to do that. Um, and wearing a binder doesn't necessarily actually help close things. So there used to be this idea that you would like wear binders postpartum to get your abdominals to close. Basically, all it does is it creates the tension that your body needs to create support that you really should be learning how to do with your own abdominal muscles. And the second you take the binder off, everything just goes right back. So it's not really doing anything for you except for in that moment. And if you're really hell bent on wearing a binder, you should have somebody look at your pelvic floor while you're wearing the binder and when you're not wearing the binder. So I'll often do vaginal checks for women in standing. So I insert a finger vaginally while they're standing without the binder on, and we look at the position of their organs and their pelvic floor and its ability to contract. Then we'll don the binder, and then we'll see what's happening once the binder is donned. I would say 9 out of 10 times I see a toothpaste tube effect. So if you think about a toothpaste tube and you squeeze it in the middle, something's got to go somewhere, right? That toothpaste is going to come right out the bottom of that toothpaste tube. So you can't squeeze in one place and for the pressure not to go up or go down. So oftentimes you'll see that bulge in the pelvic organs coming downward when they wear the binder. And I would expect that long-term prolonged use of binders could actually lead to prolapse. You're not going to get it if you're using it temporarily or here and there. It's not something that I think would make prolapse worse. We know that there's high increases in intra-abdominal pressure just when you go from sitting to standing. So suggesting that wearing a binder for a small period of time would do that is doesn't make sense because we go from sit to stand like 1,000 times a day. Um, but over time, if you're going to wear it for months on end, then I think that that would be probably a really bad idea. But if you're one of those amazing people that can don it and your pelvic floor is just like so strong and your organs are not going down at all, then there's no harm in wearing it. And I do think that people benefit from light pressure and support to the abdomen postpartum, right? Like I love a pair of high-waisted firm yoga pants, just to hold it all in. Baby Belly Band makes a band that's actually intended for pregnancy that's kind of like a thick neoprene. And I think that you can even use that to just kind of wrap around yourself lightly to give yourself that feeling of support in the early postpartum days if you need it. But the idea is not to like cinch yourself in tight with it.
Right. Yeah, especially postpartum. But what if it's been like years after you've had a baby? Like, then what are your thoughts on like a waist trainer? Because, I'm thinking like the Kim Kardashians of the world who wear all of those crazy corsets. Like, what is going on with their pelvic floors? Like, what are your thoughts on
I don't
that?
I don't know. I have never done a pelvic exam with somebody who has used a waist trainer for a prolonged period of time.
Mhm.
But I have the same rules still apply, right? The pressure
Yeah.
has to go somewhere.
Right.
So it's either going up into your diaphragm and it's affecting your diaphragm's ability to create full excursion and lower. So you're reducing your capacity for your lungs and your ability to breathe, or it's going downward, right? So um, I think maybe they just have really super strong pelvic floors that are able to withstand that pressure. But I think it's one of those things people have to balance their choices in life, right?
Mhm.
And I try not to be judgmental around people's choices. So if wearing a waist trainer is something that is very important to your image and who you are, and that's something you're going to do regardless, then we need to figure out ways that we can help you to withstand that pressure, right? And to support your pelvic floor. Um, we see other instances where people use devices. Like if you think about women who like to bind because they want their breasts to be smaller, right? They can
Mhm.
often get irritation in the skin where the binding gets too tight and they're causing themselves basically wounds and irritation to the tissue, but they're not going to stop binding. So, what can you do to help them get through that? Um, so, would it be my choice? I would not wear a waist trainer, but that's not vital to, you're only seeing me from here up on the screen. So, it's not vital to my image. Um, but yeah, that's how I feel personally. There's like the physical therapy Liz answer and then the personal Liz answer. Personally, I would not do it. If you're a patient, I will tell you what it will do to your body and then you can make the educated decision about what you decide to do and then we will deal with the repercussions on the other side of
The repercussions. So basically, probably not a good idea, y'all. But if you really want to do it, she'll still talk to you about how we can
it.
work through it and not suffer too many consequences when doing
Exactly.
that. Okay, good to know. I love it. And in addition to physical therapy, Liz, like what other aspects of postpartum care do you think are important in just the overall recovery and well-being?
I think the biggest is probably mental health.
Yeah.
Um, I mean, I had postpartum depression so on my brain with my patients right before I had a child, and I didn't think about postpartum anxiety.
Mm.
And it wasn't until I was going, my mother is a mental health professional, and she was taking care of me that like first week postpartum, and she said, Liz, I think, I think you might have postpartum anxiety. Like, why would you say that? She
Don't
was
all mothers worry? Isn't that like part of the thing? And you're probably like, well, there's worry and then there's like clinical
right.
anxiety.
Yeah. She's like, here's the list. Do you think any of those sound like you? I'm like, well, all of them, right? But I wasn't thinking about anxiety as a mental health condition. I was like, I'm not depressed, right?
Yeah.
That's what everybody's so worried about is depression. People aren't thinking about anxiety. And that's why we need to have mental health. I will tell you at Origin, we screen every single patient, not just our postpartum patients, for anxiety and depression so that we can look at that, how they rate themselves and recommend a mental health professional if their rating is high enough. But I tell you what I do, even if their rating is like a zero, if they're like, I have zero concerns for that, I will still ask like, hey, you rated as though you have zero concerns, but I would love to give you a referral if you feel like you would benefit from that. And some people will still say yes, even though they feel like they're having no issues. So I also think that mental health is really having its day right now. It's similar to pelvic health, and people are really talking about it. But I still think that it gets overlooked. So,
Yeah.
and you have, if but sometimes the physical and the mental go so hand in hand. If you're
Yes.
not out there and you're not running, then you're more anxious or you're more depressed, right? Or you feel more cut off from society because you're not out there with your community, or you don't go out to eat with your friends because you're afraid you're gonna fart in the middle of dinner, and because you can't control it, and so it's isolating, right? It's like, really, we've all been through enough isolation with COVID. We don't need that anymore, right? We need to be able to have our bodies working for us and get out there and do what we need to do, and then when they don't, it has this spiraling effect with our mental health. So I think that those two things go hand in hand.
So true. Wow. Thank you. Yes, I couldn't agree more. Mental health. And I am so glad that more people are talking about it. And I hope, just as much as I hope with pelvic floor therapy, I hope that it just becomes more accessible and more normalized to go and seek that support
Hmm.
at any time of your life, but especially after having a baby.
Well, I'll tell you, it is becoming more accessible. At Origin, we have virtual physical therapy in nearly every state. I believe it's 48. So, and I know people don't think about pelvic health being something that you would do virtually, but
Mhm.
I can explain to a patient how to do an exam or how to look at themselves on their own and then come back to me with the information. And we talk about what a plan is for them, right? I can look at them doing exercises and we can talk through all of the things that affect their pelvic health. So there's so much more that you can do virtually, I think, than people expect. And that's something that's accessible, right? Origin's taking healthcare. So having insurance to be able to access it, that's another thing. That so much of pelvic floor PT in the past has been through private providers that take cash only. So the tides are turning, which is positive, and I'm excited about that.
I am too. That's wonderful. And Liz, what advice would you give to new mothers who may be feeling just overwhelmed and uncertain about their postpartum recovery journey?
Sure. Oh, I just got teary a little bit in my mind when you asked that. That you're not alone. So there is so much to get in our heads about, and just wondering, like, will I ever be me again? Right? Whether if that's in a career, if that's in a relationship, if that's in your body. And the thing that I would like to tell people is that instead of thinking about going back to who you were, let's think about who you could be going forward. And I would argue that it could be so much more.
Beautifully said, Liz. Oh my gosh. Yes. Ugh, amen to everything. And thank you for sharing that. Oh my gosh.
Of course.
And do you have any just final thoughts to wrap up our show and also then share where people can find you?
Sure. Um, Final thoughts. Pelvic health is self care.
Amen.
So
Stitch that
we're
on a
like,
pillow, please.
yeah, like, I got to get my nails done. That's self care. I got to get my hair done. That's self care, right? Facial, look, whatever it is that you do for self care, read a book. Pelvic health is also self care. So you don't have to live with it. Okay. And yeah, so I work at Origin. Our website is theoriginway.com. So you can find us there and to find a physical therapist that can help you. So check it out.
I love it. Oh my gosh. Liz, thank you so much for your time and for sharing your wealth of knowledge with all of this. I feel like I have learned so much. I feel like I knew a lot about pelvic floor physical therapy, but apparently not enough. So thank you so much for all of this information. It was just also such a pleasure chatting with you.
My pleasure, Nina. And thank you to you for doing this.
Oh, absolutely. Oh my goodness. And for our listeners out there to learn more about Liz, you can find her online, as she said, at theoriginway.com or on Instagram at theoriginway. Our team will be posting today's episode of our baby chick. Sorry. Our team will be posting today's episode on our Baby Chick Facebook page and Instagram page at the Baby Chick Chat. So if you have any questions or comments about our discussion, please follow these accounts and share your thoughts and questions with us in the comments section. And as always, if you haven't already, please subscribe to Chick Chat, the Baby Chick podcast, wherever you listen to podcasts, and leave us an honest review. Cheers to taking care of yourself postpartum.